Hi, my name is Michelle Hall. Thank you for joining and welcome back. Today I'm going to demonstrate an X-ray film and how you should handle it and what's inside an X-ray film. I find it quite hard at the moment trying to explain to students what is an old-fashioned X-ray film. Everyone's on digital now, so these are automatic processing films. So I'll go through that in a moment. These have been supplied by L&L Dental, so thank you very much for your support. And just for the purpose of the video, and I'm at home, I'm just using my own props at the moment. So this is the special waste. So when you've got your box of X-ray films in the dental practice from the supplier, they'll just come in a box like this. This is just one make. There's several out there on the market. So when you open the box, most dental practices just put this whole box in the drawer. So we only use these if we're doing automatic or manual processing of an X-ray film. So these will go just straight in the drawer like this. Or you might have to just take the stock out and put them in your own containers in the drawer, whatever suits you at the practice. Do not ever leave this on the worktop. One, decontamination as well and cross-infection, and the other reason is because the X-ray films, they can get exposed. If you're taking X-rays day in, day out, and they are near the X-ray machine, these will also be exposed and you'll end up with a rubbish film. So let me just talk about stock rotation then and why we need to stock rotate. So if you can imagine this brand new box being placed in the surgery drawer, the dentist is taking X-rays daily, weekly, we do go through quite a lot. So imagine he's took that many X-rays. You've then got half a box. For a dental nurse, we need to be checking stock every day. We don't want to be running around in and out the room. One, it doesn't look professional. Two, you shouldn't be leaving the dentist alone for a long period of time with the patient. So that light's shining. So if we have got half a box and you need to restock that, instead of putting the new ones at the front, these are going to stay at the back. That's not going to be very good. These can end up being sat there for months, weeks, years even, if you're just constantly filling up the front of the box. So we rotate stock. So what we do, we get the old stock and just push it forward. So when we do get the new stock, we put the new stock towards the back, like so. So you're continuously rotating that stock and all of the X-rays will be used. So that's that part gone through. What I will go through now is the X-ray film, what it is, what's inside it. A lot of nurses ask me this, they've never seen a film before, so thank you again to L&L Dental for supplying these for me. Most practices are digital, there's lower dose to the patient, it's quicker, it goes straight on a computer, there's no chemicals involved, there's no processing, it doesn't take a long period of time. So in my next video, I am in the process of trying to get an automatic processor so I can demonstrate how this goes through the automatic process. Right, so in the meantime, if you was to develop this, you would be in a dark room. You shouldn't be opening this in any light whatsoever, because all you're going to do then is ruin the film. It won't be able to be used. We're going to have to expose the patient again, and that's not good to keep exposing the patient to radiation. So what is in this film? So if I was in a dark room now, ready to put the film through, it's all about touch and feel. You need to get to grips with what's inside this. So the dentist has took the X-ray. I'm developing, these are a bit stiff, so I'd open the plastic seal. Now in the plastic seal you then have a piece of cardboard and you've got lead in here as well. So the best thing to do, you could either, when you do get used to doing these, you can either just feel around and feel your X-ray in the middle. So that's the plastic one, not touching too much. You could pull it out that way and you could develop it. That's one way. So that would go straight through the developer. All this then is waste. The lead is special waste. So that would go in your special waste. This could go in the bin. So that's one way. The other way is to take everything out. And this is what I want to explain to you today, exactly what's in here. So again, instead of just pulling the X-ray out, I'm just going to take the whole thing out to demonstrate. So again, this is plastic, that's normal waste. We'll just put that on the side on the X-ray room. We can bin it afterwards or put in your clinical waste bin, but it's not contaminated, it's nothing clinical, so that can just go in normal waste. So then we open the paper. If you was in the dark room, it is like being blind, so you could see if something rips. That's when you know you've got your paper, and you've heard that sound, you can feel it, so you'd know that is your paper. Now the paper goes all the way round, so you've got paper on this side as well. So if you know it's paper, you can bend it, rip it, stick it on the side. Then you've got your lead. Now you know when you've got the lead because you can bend it in half. You can crumple it up. Lead is special waste. It's toxic, it's classed as poisonous substance, so that needs to go in the special waste. So then you're left with your X-ray film. That is plastic. You would then hold at the edge and it would go through the X-ray machine. Now just to note, if you was meddling around and having a look for your X-ray machine, your X-ray film, sorry, you shouldn't be touching the film like this. All that's going to do is put fingerprints on there, then you're going to end up with a foggy film once it's gone through the developing stage. So try and handle it just a corner only. That's why it's really important to get your head around where it is. So it's in the middle of the paper once you've opened and took it out of the plastic. Get rid of your lead foil and then you're left with this, and just hold it on the edge. That will then be sucked in the automatic processing machine. It goes through a developing tank. It goes through that, and then it goes through a fixing tank, and then it goes through a watering tank, and then it's completed.